big breakthrough here for anybody looking to tighten up some problem areas, one in particular. The FDA has now approved the first non-surgical treatment to get rid of a double chin. Only 180 plastic surgeons in the country are trained to offer the treatment. One of them has an office right here in Charlotte. Coming up at 7:30, he's going to stop by the studio to show us how it works.
All right, thank you so much, Chuck. 7:35 now. We're talking double chins. The FDA approved a drug to help people get rid of them. The drug is called Kybella. It is the first non-surgical treatment to treat double chins. There are only 180 plastic surgeons in the country trained to offer this treatment. One of them practices right here in the Queen City. Dr. Stephen Finnicle is with Charlotte Plastic Surgery. He's joining us this morning to talk about how this procedure works. So thank you for being here.
Yeah, great to be here.
So tell us, it's actually an injection that goes straight into the double chin, correct?
Correct. What you want to do is target the fat underneath the skin, so between the skin and the muscle layer in the neck. So you evaluate it by squeezing that area, seeing how much thickness there is, and then we apply some numbing medicine, and then through a special grid inject it very precisely so that somebody can have this injection done, they can be back to work that afternoon.
Wow, that quick of a recovery. But how many treatments are we talking about?
Well, anywhere between 2 and 4 treatments is what people should expect.
Okay.
But remember, no recovery, so you're back to work, so you're not taking out downtime like a surgical procedure would.
Now, I don't know if you were here for the beginning or a little bit earlier this morning. We've kind of been giving Nick here a hard time, though he's offered up pictures.
Yeah. We actually scrolled through the show yesterday and picked out some really flattering pictures of myself. There it is. I don't know if you can get too close to the screen there. A couple shots of the double chin. This next one, I think that's my favorite. Yeah, the face to go along with it. And then also that. And we talked a little bit earlier before this, Doctor. It comes down to 3 things, right? The double chin does,
correct.
Right?
Aging, where people lose a little bit of skin tone and gain some fat there. Just people being overweight and having extra fat there. And most patients that I think are going to be good patients are going to be just congenital because they have good skin tone, like Nick, normal weight, and just has an extra little thickness of fat underneath there.
A lot of people are calling this liposuction in a needle. I think that's what it's being called. What exactly is it doing, though?
Well, it's deoxycholic acid, which our body produces in our liver to dissolve fat that we eat. So we already have it in our body. So this is a synthetic form that we put in as an injection, and it actually permanently kills the fat cell. So it never comes back. It's a permanent result.
Now, for people, I mean, is there any exercise that you can do to kind of counter a quote-unquote double chin? Can you do anything like that?
It's not a muscle. It's a fat storage area. It's a natural fat storage area, and for some people it just is a little bit thicker than others.
Yeah.
And now it can be adjusted without surgical.
So if I go home and chew like 8 pieces of gum at one time, that doesn't help?
No, that tightens the muscles in your face, but it's not going to work that particular fat area. This is targeted.
Gotcha. I remember old school. They're like, you know, do those types of exercises to
there were those machines, yeah.
Well, you can certainly tighten the muscles of your neck, but this is above the muscle. This is an area of fat that lives on top of the muscle, so it's not going to be reduced.
Are you seeing a lot of people in Charlotte who are actually saying, hey, I want to have this done?
People are getting real interested in it. It's been really, really exciting. Since it got approved by the FDA, the phone has been ringing.
Yeah, I imagine it would be. And I love that it's permanent. So we want to stress that it's permanent.
Correct.
Maybe 2 to 4 treatments and you're done.
Correct.
And you said just maybe a little bit of bruising and that's
people have bruising for about 24 to 48 hours, and then once that bruising settles down, in the trials, people had some tenderness to touch for about 7 days, and they had a little bit of feeling of bogginess for about 10 days, and then you see the result by a month. So if you need another treatment, you can get it in series in a month.
Oh, that's awesome. Wow, such awesome stuff here. Right in the Queen City. Dr. Finnicle, thank you so much for joining us, letting us know about it.
Thank you.
And yeah, this is going to be really awesome. You're going to have it done, Nick?
I don't know. We'll have to see. We'll have to talk after this. Sound good?
Oh, it sounds good.
All right.
All right, so now let's head out to Charity Bailey to see what she's up to on this Thursday morning.